All right, future massage therapists, welcome. In this explainer, we're going to break down a skill that is absolutely at the core of our practice, how to properly position your clients. And trust me, this is about so much more than just comfort. It's about safety, it's about effectiveness, and it's about really understanding the body on a much deeper level.
So let's just jump right in with a big question. I mean, how does something as simple as lying on a table connect with the incredibly complex workings of our nervous and circulatory systems? The answer to that is the key to why all of this is so critical.
Well, to answer that, we've got to dive into a core scientific principle that really underpins everything we do in therapeutic touch. And that principle is body mechanics. I want you to think of body mechanics as the operating system for the human body. It's the science that studies how all of our amazing systems, our muscles, our nerves, our circulation, are designed to work together in perfect harmony. So you see, proper positioning isn't just about getting to one muscle. It's about supporting that entire interconnected system.
And you know, what's so great about this is that the skills you're learning here aren't just for the massage room. Nope, they are part of a universal language of care that's used in physiotherapy, in nursing, and in post-op recovery. It's a truly foundational piece of professional healthcare. Okay, so if we're going to talk the talk, we've got to use the right lingo, right? To discuss these positions like the professionals we are becoming, there's one key term you're going to use for the rest of your career.
And that word is decubitus. Now, I know it sounds a little intimidating, a little technical, but it's just the professional term for all the different reclining positions you'll put your clients in. Its meaning is actually super straightforward. And that's because it comes straight from the Latin word decumbere, which literally just means to lie down. So from now on, when you hear decubitus, I want you to just think the professional art of positioning a person who is lying down. Simple as that. All right, terminology. Check. Now let's get practical. There are 3 foundational decubitus positions that are going to be the absolute bedrock of your entire practice. So we've got dorsal, which you'll also hear called supine. Then we have lateral, and finally prone or ventral. Let's dig into what each of these really means for you and for your client. First up is dorsal decubitus, but honestly, you're almost always going to hear it called the supine position. It's exactly what it sounds like. Your client is lying face up on their back. This is going to be the starting point for a massive range of treatments you'll perform. Second, we've got lateral decubitus, or having the client on their side. Now, this one is absolutely essential for getting to muscles in the hip, the shoulder, or the IT band. It's also a go-to for clients who can't lie flat for any reason, like during pregnancy. It's a must-know. And number 3 is prone, or ventral decubitus. This is your classic face-down position. But, and this is a big but, you have to remember this position absolutely requires the right equipment. You need a proper massage table or face cradle with an opening so your client can breathe comfortably and, most importantly, safely. And check this out. The prone position has incredibly powerful uses way beyond massage. During the COVID-19 pandemic, for instance, doctors in the ICU put patients in this exact position, and it became a vital medical intervention to help them get more oxygen. It's a pretty stunning reminder that understanding body mechanics can literally be life-saving. Okay, so we've got the flat positions down. But what happens when we start to play with another force? What happens when we add gravity to the mix? That's where we get into inclination. There are 2 key variations here. First is the decline position, often called the Trendelenburg position, where the feet are up. This uses gravity to help blood from the veins return to the heart, which is amazing for clients with swelling in their legs. Then there's the opposite, prone inclined, where the head is up and the feet are down. This can be great for things like sinus drainage. And there's one more important variation to pop into your toolkit, and it's called the anti-shock position. It's a bit like Trendelenburg, but here only the legs are raised up, while the client's body stays flat on the table. All right, let's bring this all home. We've talked science, we've learned the lingo, and we've gone over the core techniques. Now let's see how this all fits into your day-to-day professional life. I mean, just look at the range here. Your understanding of decubitus is essential for literally everything, from an aesthetic massage and lymphatic drainage all the way to working with physiotherapists or helping clients in post-surgical recovery. This isn't just theory, you guys. This is your daily practice. So, I'm going to leave you with this question to think about. You have the foundation now. Mastering these positions is about way more than just technique. It's about your professional responsibility. This knowledge is how you build a practice that is safe, that is comfortable, and that is truly effective for every single client who puts their trust in you.